Yeah, and good afternoon, everybody. And thanks so much for inviting me to Amsterdam. First time I'm here. Not the first time in Holland or in the Netherlands, but in Amsterdam. I am honored to be invited to present my experience with work in Ethiopia. I came to Ethiopia the first time with my family in 1987, and I haven't yet got any return ticket. So I'm still in Ethiopia, but I am in Norway from time to time. So, experience in capacity building. I think it's better if I do it like this. In burns, especially, and reconstructive surgery. And I've been in Ethiopia now for 20 years. What I faced when I came to Ethiopia, working in a very busy referral hospital in South Ethiopia, Mission Hospital, where I was working for 6 years. Those years formed my future. I was about to become a general surgeon, and I became a general surgeon, but I left it all once I had a chance to go into plastic surgery, because all these burns, they were really, really tough and difficult to manage. But I got a mentor from University Hospital in Bergen. He came out and he gave me some hints. It was just like an eye-opener. It took many years since I read this article in Interburns of 2013, which really, really made sense. And it is WHO that is quoted, "Burns is the forgotten global public health crisis." And using a word like crisis, that is something, isn't it? And WHO is saying this. In the same magazine, the same article, there were even more statements. Listen, incidence of burns requiring medical attention is higher than the combined incidence of tuberculosis and HIV. Can you believe it? Is burns that common? Yes. It's even more common. And even though it is a major cause of death and disability, especially in LMICs, burns have no funding, almost no funding. And it is very many places an unrecognized issue at the national and international level. So these comments started to make sense when I think back to 1987, when I came to Ethiopia, how burns were everywhere, everywhere. And I came to a hospital. I was the only doctor at that time. I arrived with very limited experience from Norway. But as a doctor coming to help Ethiopia, I should master everything. So I started also with burns. And I got a Hambi knife in my hand, and I just had to start. But I failed. Time and again, it was so difficult. There was no one to ask for help, seemingly, until there was one working in the same OR and health assistant that were just assisting in operations. He had 1 year training from school, and then he was working in the operating room. And after seeing me, and this is the first time I encounter training in Ethiopia, training how to transfer knowledge. That's why this conference is arranged. So the first experience of training in Ethiopia was when the health assistant, looking at me, finally said, "Doctor, shall I help you?" And here he is, a health assistant who had used the Hambi knife many, many times. I didn't know it. It was just like starting to cycle for the first time. You manage and you will continue. I'm grateful to that guy. From that moment, we started to do a lot of started courses in South Ethiopia for general practitioners, for nurses, and this is from Sodo, it doesn't mean anything to you. And also in my own hospital, Irgalem Hospital, where we also provided all the participants from various hospitals a silver knife. Do you know what a silver knife is? It's very appropriate equipment to make skin graft using a razor blade. And I used that several years. It's an excellent small little instrument. And my mentor from Haukeland University Hospital in Bergen, Dr. Paul Gravem, he joined in these courses, and we arranged several courses. Here also at Black Lion, the biggest hospital in Addis Ababa, where we also trained, or not trained, we arranged courses, 4 or 5 days of courses only. But after these courses, many of them, we came to realize this is not sustainable. This doesn't really make any difference. It's nice to come to a conference, but so what? So this led to an agreement with Minister of Health in Addis Ababa on starting the very first burn unit in Ethiopia at Yekati 12 Hospital on the bottom left, in collaboration with my hospital in Norway, Haukeland University Hospital. Oh, time is running very quickly. Quicker now than the previous. So we started the sandwich training program, where part of the training was in Norway, part of it was in India, and the remaining in Ethiopia. And most of the training was actually in Addis Ababa. Nurses should always have a photo or two of nurses. They are the backbone of any burn unit. So giving them good feedback and good training is so important. I have to go very quickly now. This is the first photo I have from the first. This is the first plastic surgeon trained and graduated from this training program. Now I think we have 15, 16 already. The last 10 years I've been to this hospital in Addis Ababa, Myeongsan Christian Medical Center, where we operate a lot of burns. I have a charity ward in this private hospital, and we receive quite a number of patients. And the young doctors are both under training in plastic surgery. Both these doctors left there, and Dr. Fikru there. And we have other doctors we have trained. We have Dr. Lydia to the right. She also wants to start training, and it is in the COSEXA system where we can train these people. But we did also have started training health officers, because you don't have surgeons everywhere in Ethiopia, but health officers can also learn how to do skin graft. And this guy in the middle, top in the middle there, Dr. Anton, I call him doctor because he's doing fantastic work after 4 months of hands-on training in Addis Ababa. There he is in his hospital far to the south, and he is doing really marvelous surgery. I'm not attending at all. He's doing it. But he gets equipment from us, Hambi knives, blades, and mesh machine. Equipment is not always as I wanted it to be. The rooms and the wards are very filthy and dirty, but still we can manage. It's not an ideal situation though. But there are challenges. We have very little equipment. We have to bring our equipment. We have installed equipment and made a new OR in this hospital, and we bring the equipment to do surgery and leave it behind. The last photo. There are some unexpected challenges. I just want to close with this. We have worked now with Minister of Health in Addis for 15, 16 years, but still it is very difficult to purchase this equipment in Ethiopia. So still I have to bring it in my luggage. There's no way you can get it in Ethiopia, which I don't understand it. And we have talked to them so many times. Yeah, it is a system that works slowly, and it does indeed. And this equipment, I think, is mandatory in order to be successful in burn surgery and reconstructive surgery. I only use Hambi knife. I don't know how to use an electric dermatome, and I never use it. But Hambi knife, fantastic. So this is the closing remarks for possible discussion. I'm concerned about particularly point 2, not to quit a good program, because it says in the document, the application form, that you will exit at time December 31st. You will be out. But I don't believe in that. I think it is working against the intention of the program that you initially started. And I've been in Ethiopia long enough to really to underline that. And besides that, we shouldn't stop supporting a program that we somehow have left now. They need support. They cannot get it anywhere in the country, equipment. But we need to be there to support it. Thank you very much.